Hello, it's Stuart Phelps, and I'm here with my friend, Dr. Stuart Frost from Mesa, Arizona. And we're excited to share with you some information about the Airway Anatomy Forum that's less than 5 months away, October 24th and 25th in Santa Clara, California. And the key part of this forum is to have doctors present diagnostics for cases, their treatment plan, the treatment they provided, and then showing before and after the changes in anatomy. And we've asked Dr. Frost to cover non-surgical correction of a retrognathic mandible. We will also have surgical correction. And Dr. Frost, can you share your thoughts on the Phelps appliance and maybe what you'll be sharing with everybody?
Thank you, and thank you for letting me be a part of such an amazing meeting. I've been using the Phelps appliance for almost 25 years. And when we use a Phelps appliance, a mandibular repositioning appliance in treatment, it hasn't been until the last few years where I've really paid attention to what's really happening. Now, all of us know that if we move the mandible forward, we're going to see chin come forward and we'll see the tongue come forward. But it hasn't been until recently that I've actually been measuring and looking at what that has done specifically to the airway. And for me, part of what has been exciting about this whole process is really working through and designs on how to use the Phelps so that we get full mandibular translation forward and see what that does to airway and breathing. And I'm excited to share with you that I'm seeing airways double in size by mandibular repositioning appliance such as the Phelps. And as if we design it correctly, we get these beautiful big airways and patients change. We are going to back this up with showing CT scans and true 3D points and back it up with 3D superimpositions. So we'll show that as well. Excited about this little lecture we're going to do and excited to show you some before and after treatments.
So Dr. Frost, there are a lot of providers, orthodontists, general dentists that are negative on the Phelps appliance due to concerns about restricting the growth of the maxilla or distalizing upper molars. What are your thoughts on that? Will you be reviewing that?
This is fair. It's a great question. And if I'm very transparent, I've seen that in my own practice over the last 25 years. And so for me, with the design that I do and protecting, I want upper arch forward, I want upper incisors forward. And with the design that I'll show you, we're protecting that maxilla and keeping it forward and then bringing that lower jaw to meet it. So we get to show the CTs and show what happened to the maxilla, show what's happened to the incisors and 3D superimposition. So I'm excited to show that to you.
I love it. I'll be in the front row taking notes. I hope you can teach me how to protect the maxillary position. So the event is Friday and Saturday, and you're presenting on Saturday, but you're also hosting one of the roundtable discussions for dinner on Friday night. You want to share a little bit about what you'll be discussing?
One of the topics that I'll be discussing at the roundtable is a passion of mine, which is how to correct gummy smile patients non-surgically. And over the past 20 years, we've had so many advances in orthodontics with temporary anchor devices or TADs or mini screws that we'll use in the maxilla to help us intrude the maxilla. And I'm excited to share with you some of these advances, talk through what that looks like, and even if we have time to share some of the results. So I'm really excited to show you a non-surgical gummy smile correction.
So if people register, as long as there's still spots at your table, they can join your table for the dinner on Friday night. All right. Well, I can't wait till October. Looking forward to learning from you, and I really appreciate you contributing to the knowledge base that everybody's sharing in this event.
Thank you for having me.